is based on the premise that a properly functioning spinal column is a necessary component of good health. Your spinal column is made up of 24 movable bones separated by cushioning intervertebral discs that act as shock absorbers for the spine. Just as the skull provides the protective covering around the brain, your spinal column gives protection to your spinal cord. This bony architecture provides the protective support of the nervous system while allowing movement necessary for your everyday activities. Your nervous system controls and coordinates the function of virtually every tissue and cell in the body. Through a vast network of nerves, the brain sends messages to different parts of the body to regulate the function of our body. Muscle movements, coordination, breathing, and blood flow are all controlled by the nervous system. Housed within the bony architecture of the spinal column, your spinal cord acts as the switchboard for messages arising from the brain and messages coming back from the body. Through the delicate spinal nerves that exit the spinal column at each level, communication between the nervous system and the body takes place. Looking closer, these nerves supply the joints of the spinal column as well, including the discs and the joints in the back of the spine. From the front, your spine should be straight, much like supporting beams. And from the side, your spine is composed of 3 curves, one in the neck, one in the middle back, and one in the lower back. Like the curve in a bridge, these curves provide the structure and support your body needs. Injuries, everyday activities, or poor posture can cause the spinal bones to lose their proper position, which causes nerves to become irritated, setting the stage for spinal problems, including pain. During the initial examination, problem areas of the spine are identified and their role in contributing to your current condition are considered. These are usually areas of the spine causing pain. Your spinal balance will be assessed by analyzing your leg length to get an idea of the symmetry of your foundation. You'll be asked to perform movements to contract muscles that originate from different areas of your spine. These tests are used to isolate different regions of the spine to determine if a problem exists. Your doctor will use these tests, combined with other measures, to determine areas of your spine that require attention. The joints of your extremities can be assessed using these procedures as well. When your body is found to be out of balance, the doctor will deliver a chiropractic adjustment into the problem area using a special handheld instrument called an activator. This instrument was specifically designed to deliver a precise, quick thrust that is gentle, safe, and specific. The thrust delivered by the instrument is so quick that it accelerates ahead of the body's tendency to tighten up and resist the adjustment, producing mobility in the movements are thought to reset your system. In a sense, like
today, thousands of chiropractors and millions of patients have benefited from instrument adjusting. The mere numbers speak for themselves. 10,000 chiropractors reported that over 70% of chiropractors use an adjusting instrument in their practice. We all have those situations in practice when we desire to use less force to administer the adjustment or deliver a non-rotational chiropractic technique. This is the perfect opportunity to use an adjusting instrument. And let's face it, many patients simply prefer the low force and specificity of an instrument-delivered adjustment. The result is satisfied patients who enjoy returning and refer their friends and family. Incorporating an adjusting instrument into your practice also allows you to expand the services that you provide, from caring for pediatric to geriatric patients and everyone in between. You'll also find that you can treat extremities and sports injuries with ease. And for the doctor, using an instrument is hand and wrist pain for many doctors due to the squeezing rubber handle grip to further minimize recoil. Thanks to the new instrument design, you can stop beating yourself up and benefit from many more years in practice without wrist crisp, fast, and specific. The device is very light and is made of strong and durable plastic that will hold up over the years. With over 70 publications in some of the finest scientific journals in the world, Professor Keller is well known in the fields of orthopedics and biomechanics. He is currently a full professor in the departments of mechanical engineering and orthopedics and rehabilitation at the University of Vermont. Tony also has several patents to his credit, with several from his inventions of other chiropractic adjusting instruments that are currently in the market. Activator Methods Chiropractic Technique textbook, and in 2003, we received the highest honor at the World Federation of Chiropractic for our...
Produces about 75 newtons, which is lighter than the spring-loaded devices that are currently on the market. At 150 newtons, the medium force setting is similar to other chiropractic adjusting instruments. The high force setting produces 300 newtons, which is almost twice as much as other handheld adjusting devices.
The lowest force setting is enabled with the switch in the down position. We like to use this setting for the upper cervical region, for pediatrics, and for excessively tender areas of the spine and extremities. In the middle position, medium force adjustment is selected. This setting is ideal for adjusting the thoracic spine, lower cervicals, and many of the extremity joints. With a switch in the up position, the highest force setting is selected. The high force setting is ideal for use in the lumbar spine and sacroiliac joint, where more force is needed to accomplish the adjustment. Instrument's 3 force settings. You can get a feel for the force settings by activating the device against your hand. Always ensure that you've selected the right force setting that you determine is clinically indicated.
Over the past 20 years, I have conducted spine biomechanics research with university support and funding from government agencies, including NASA and the National Institutes of Health. During the past journal, Clinical Biomechanics, we reported that dynamic mechanical excitation of the spine will produce up to twice as much bone movement. It illustrates the spine motion that occurs with impulsive type adjustments. Mechanically stimulate a multitude of frequencies within the body. Note that the pulse duration is only 2 milliseconds or 1/500th of a second.
An additional benefit of impulse is it's once and the instrument delivers one thrust. Hold the trigger down and the instrument thrusts continuously at 6 Hertz. Have you ever wondered how hard to preload prior to thrusting? Impulse has preload control built into the nose piece of the instrument. This feature guides you to know how much force to apply prior to delivering the thrust. Simply press down until the spring is fully compressed and pull the trigger. You'll achieve the optimum soft tissue compression with this preload control feature. The impulse adjusting instrument comes equipped with a single stylus. Simply push the stylus into the nose piece until it... Just pull out on the stylus and push in the dual stylus. It's that easy. Listhesis subluxations in the cervical and thoracic spine. In the lumbar spine or on the sacral base, the lumbar dual stylus is used in the same